Hello dear friends. In my last video, I told you how to save $12,000 per year. Today, I'm going to help you decide whether you really need a private health insurance. Is it worth having a health insurance, or if you are financially better off without it? Watch till the end of this video and you will be able to decide for yourself if you need a health cover. Private health insurance premiums are increasing faster than wages or inflation. Therefore, we have to look into it more deeply and see whether we are getting our money's worth. In a country where we already have access to free health care, is taking out private health insurance worth? The question of whether to take out a private health insurance policy or rely on the public system isn't an easy one to answer because it depends on your personal situation. For some people, private health insurance is a necessity. Others can breeze through life without really needing it. Private health insurance is generally divided into two main areas, that is, hospital cover and extras cover. Ambulance cover may also be a third area of cover, but it will depend on which state you live. Almost all Australians pay 2% of their taxable income as the Medicare Levy. This money goes towards funding parts of the public healthcare system. It pays for Australians to get free or cheaper GP visits. In Australia, healthcare costs such as visits to the GP are covered by Medicare. Also, public hospitals provide best quality of care for free. If you meet with a life-threatening situation, you can get the best possible care from your nearest public hospital. Under the Medicare, you can be treated as a public patient in a public hospital at no charge by a doctor appointed by the hospital. But you cannot choose your own doctor and you may not have a choice about when you are treated, especially when it comes to elective surgery like hip or knee replacement. In the public hospital, you may find yourself with 4 to 6 people in the same room. People get private health insurance to get tax rebate. Singles with an income below $140,000 and families with an income below $280,000 can get a tax rebate on their private health insurance. The level of the rebate varies by income and age. Therefore, some people get any private health insurance policy just to get the rebate and do not think whether it is worth. Government has introduced this rebate to encourage the public to get private health insurance and not depend on the public health system. If you have a private health insurance, it pays for treatment in private or public hospitals as a private patient with the doctor of your choice. If you have a private health insurance, you can skip the waiting list for treatment, which is especially helpful if you are receiving elective surgery like hip or knee replacement, which can often involve long waiting times. You may be able to decide the date you want to be admitted to hospital. Also, you can choose your preferred doctor or surgeon to carry out your operation. Another big benefit you will get is you will be treated in a private room. But to get all these benefits, you have to pay a high price because private health insurance is very expensive. You could be spending thousands of dollars each year in premiums. With costs rising every year, often private health insurance policies only cover part of the cost of a treatment or procedure. so you may still have to pay a substantial amount. Some policies may not cover every type of treatment or surgery, and you will be left to pay for them. Therefore, we have to ask the question, is private health insurance really worth? Getting a health insurance is not compulsory. But if you don't have a private health insurance and if you are earning an income of over $90,000 per year as a single or $180,000 per year as a couple, you have to pay a Medicare Levy Surcharge of at least 1% of your income on top of your Medicare Levy 2%. Private health insurance members with a sufficient level of health cover are exempt from paying the Medicare Levy Surcharge. The more you earn, the higher the surcharge you pay on your taxable income on top of the 2% Medicare Levy. If you don't have a private health insurance, therefore, if you are earning a high income, it might be cheaper to take out the private health insurance than to pay the Medicare Levy surcharge. If you're planning on getting pregnant, you can have the baby through the public system, which is free. But if you have a private health insurance, you will get a private room and you can choose your own gynecologist. If you are living with a chronic illness like heart disease, private insurance may be worth as you may be in and out of hospital quite a bit. If you need major dental work such as wisdom teeth removal or orthodontic treatment, Medicare won't cover the cost. With extras cover, you can cover the cost. To avoid long waiting times in the public system, if you have elective surgery like hip replacement coming up, then you should get a health insurance. If you want your own doctor and the hospital for your surgery, then you should have a health insurance. If you need an ambulance cover, private health insurance will help you with the cost. If you live in NSW, ACT and Perth Metro, but not in Queensland and Tasmania, where ambulance cover is provided for free by the state government. If you have extras cover, it will help to pay for your dentist, physiotherapist, glasses and chiropractor. But friends, if you are young and healthy, you can't remember the last date you had a cold, private health insurance is probably not worth taking. Also, if you are happy with the level of care received in a public hospital and don't care who the surgeon who cuts open your wounds, then private health insurance is an unnecessary expense. There are questions you should ask before you start forking out over $500 a year for extras cover. We have to decide whether we need to see a dentist every year, whether we need a pair of glasses every year. If you are not claiming any more than $100 in these benefits every year, or if you are claiming these benefits for the sake of claiming and not for your benefits, then you should not waste money on extras. Maybe money saved from paying for the extras cover could be used to buy a pair of glasses or get your teeth cleaned every year. You should never take out cover you don't need. If the extras cover outweighs the annual benefits you receive, you should remove the extras from your policy. The lifetime health cover loading affects you if you take out hospital cover after your 31st birthday or if you have any gaps between cover. If you take out a hospital cover for the first time after you turn 31, you will pay an extra 2% on your premiums for every year waited. If you never get private health insurance, the lifetime health cover loading will never affect you. You might be better off paying the lifetime health cover loading instead of buying a health insurance you don't want early in life just to reduce your health insurance bill. The money you saved not buying a health insurance early in life can be paid to pay the lifetime health cover loading when you purchase it later in life. In Australia, there are 3,500 distinct health insurance products. While the number of policies available to you will vary depending on where you live and your individual circumstances, you may still have over 100 different policies to choose from. There are health insurance comparison sites out there, but they compare only a limited number of insurance companies. Therefore, if you want to compare, you have to visit the government website www.privatehealth.gov.au. In this website, every insurer is required to provide up-to-date information about each policy and its prices. Commercial comparison sites may help you assess your needs and choose the right policy, but you should be aware that these sites provide only some of the relevant information about a very diverse marketplace. Therefore, my friends, for singles with an income above $105,000 and families with an income above $180,000, it makes sense to buy private health insurance even if you won't use it. That's because you will find health insurance cover cheaper than the Medicare Levy Surcharge. For those who earn an income below these levels, you need to compare whether the value is more than the cost. Value consists of two components: protection from unexpected catastrophic risk and your expected use of private hospital cover. All Australians have Medicare to cover their health needs in public hospitals and are therefore protected from financial risk of catastrophic health problems. Therefore, value from unexpected risk is very small. There is value in private health insurance if you expect to use private health care, which can reduce your waiting time for certain elective surgeries or give you a choice of doctors. Therefore, you have to compare whether value outweighs the cost and decide whether paying for health insurance is worth. I hope you enjoyed this video. Please press the subscribe button below so that it will help our channel grow. We will meet in our next video. Till then, great week.